And I think question 5 is quite closely related, and maybe we've really dealt with that as well. This is about the models of service provision have changed from a more dispersed location of social and community facilities in residential areas towards a focus on co-location, which we've discussed, with facilities serving a wider catchment of people. This particular question is about, are there any appropriate locations for those facilities? So if we are bringing together a lot of dispersed smaller facilities, putting in these larger facilities, and particularly those ones that have quite a number of service providers involved in them. I mean, some of the suggestions are perhaps that they are constrained to designated town centres or on main roads, the relationship with public transport, whether or not anybody has any comments on where you think appropriate for these much larger social and community facilities, or perhaps where is not a good location for them might also be taken into consideration.
I mean, I'll just say quite simply, it's wherever the service demand is greatest, and obviously that probably is areas where A, the service demand is great, B, it's probably very accessible to public transport, and C, it might be somewhere where people can do other things while they visit that service. So a retail area would be a good example, as people are doing other services, so they can easily pop in if they need to. And inappropriate locations would be those that are difficult to get to, and the demand for that service just isn't demonstrable.
Great, thank you. Jed?
No, well, here, I think is all I was going to say. And unfashionable though it may be, access for disabled is very important.
Absolutely, thank you.
Well, again, it's just an example. I mean, we had a doctor's surgery that wanted to retire and sell the surgery, and the local health authority, this was in Bayswater, wanted to relocate it, and we're going out to bids, and they thought the Harrow Road was a suitable location to relocate it. But the local people, particularly the elderly or the young with children, said, look, on a map it doesn't seem far, but geographically we're separate from that. You know, it's a different area to us. It's not in Bayswater, it's across the Harrow Road. So after a lot of arguing and campaigning, they did find a situation for this doctor's practice within the Hallfield estate, and it served the community very well. So sometimes the higher up people think it's a convenient location, but it's because it suits their needs, and they can use the two doctor's surgeries that were in the Harrow Road there. But I don't think they consult enough at the beginning, and therefore it's important to protect local surgeries in local areas, I think.
Okay, thank you.